still feed me when I'm 64.
To 92.7 WGMD, the Talk of Delmarva. And we are starting a new show segment this week. You remember Dan Small. He is an Ask the Expert alum, and he is doing his own show now every Saturday from 7:30 to 8. And so let's get started. Good morning, Dan.
Well, good morning to you, and nice seeing you again, Susan. It looks like I'll be seeing you a little more frequently now.
Yes, and I guess the first question I'll ask you, you're going to start from the beginning with the basics of Medicare. But why did you decide you wanted to have your own segment?
Well, that's a great opening on this one. First off, what I do for a living is I help people figure out Medicare. And I explain it to them, basically educate individuals about their options. And I'll tell you, Susan, Medicare is so darn confusing that we will have no problem having a source of content to discuss on a weekly basis. There's tons of mistakes, and it's really not something that people should do it themselves on that one. And I guess adding to that, why I feel having a weekly show has merits here, especially with your wonderful station here, is that if you look at the numbers just in Sussex County alone, I think we're almost 40% of the population is 65 and over. So it's a great market for us, and our service is a great service.
All right, so it's going to give you opportunity. Now you're on, instead of once a month, you're on once a week on Saturdays from 7:30 to 8. Folks, if you're up bright and early on Saturdays and you've got questions about Medicare, let me give out the numbers. Dan's going to give an introduction to what is Medicare, but feel free to call at any time at 302-945-9292. So let's get started with what is Medicare.
Wonderful. And as far as getting started, this is going to be the commencement of our weekly show. So I felt what better than to start with the basics of Medicare. And each week, Susan, I'll be really going through some structure as far as different components of Medicare. And of course, we always have the ability to answer any questions on the fly here. So let's get started. I'm going to cover today really what we can call or label the A, B, C, and D of Medicare. And also I'll go into a little bit of history of Medicare. Now, it's with the overall description of Medicare, our purpose really is to provide the education. So I'm going to ask everyone to really buckle yourselves in. As you know before, Susan, it's quite confusing. It can be a bumpy ride. So the reason Medicare can be such a harrowing journey is because it's so darn complicated. And I would have to say that the reason it's complicated is it's a government program. And with a government program that's been around for a while, new plans have been added to Medicare. And those plans follow different rules than what original Medicare follows. So you have really two sets of rules out there, and that's where the confusion lies. So with these different set of rules, someone can easily find themselves in the wrong Medicare plan with some options, as you and I discussed before, no longer available. And keep in mind that many of the mistakes that can be made, and no one really should be feeling any guilt on doing something wrong with Medicare because, again, there are so many twists and turns. But many of the mistakes that one can make in Medicare will often stay with you for life. So it's really, really important to get things done right from the start. So what's our role out there? I'm an independent benefit advisor specializing in Medicare plans. As an independent broker, we don't work for any specific insurance company. Basically, we work on behalf of the prospective policyholder, and our role is really to, number one, educate you about all the options. And when I mean all the options, as an independent broker, we're not captive on one or two insurance companies. We get to represent really all the top carriers that are in any given market. And our market on where we help people with Medicare presently is Delaware, Maryland, Pennsylvania, and New Jersey. So we cover a pretty wide spectrum, Susan. So let's go in a little bit about Medicare itself. It's been around since 1965. And original Medicare is really two parts. It's known as Part A and Part B. So we're now talking about Medicare Part A, Medicare Part B. Medicare Part A covers hospital expenses, home health expenses, skilled nursing. And then the Part B of Medicare will cover really the doctors and other healthcare providers. Now, note, prescription drugs are not covered by Part A or Part B. Now, you can go into an awful lot of detail and review of all of the coverage items of original Medicare Part A and Part B. But I'll tell you, Susan, in my years in the business, I've never done that. And the reason being is that overall, it's just best to look at your Medicare option, original Medicare, as covering 80% of your healthcare expenses, excluding the prescription drug component. And so really that's the coverage that you get for original Medicare Part A and Part B. And the Part A is for most people, and anyone who's really worked over 10 years in their career, is known as premium free. So it doesn't cost anything for the Part A Medicare. But the Part B does have a premium associated with it unless someone happens to be in very, very low income bracket on that one. Low income, limited resources, they could qualify potentially for some extra help known as Medicare savings programs. But aside from that category, everyone has to pay for Part B. And Part B is based on really an income, your tax filing, and they'll always look at a 2-year look back, Susan, for that tax filing, for setting your Part B rate. Now, for 2021, the Part B premium is $148.50, and the threshold to dictate whether you would be charged higher than that amount would be based on incomes. I believe that income level right now is $88,000 for an individual and $176,000 for a joint filer. So restated, the Part B premium that everyone has to pay of $148.50, that's set for those that are under $88,000 or $176 for a joint filer on that. And then if your incomes are above that amount, there's about 4 or 5 different brackets. And it can go up to, the $500 range for the top brackets. So for most people, they'll be paying a Part B premium of $148.50. And with that, they're getting 80% medical coverage with the ability to go to any provider in the country. However, that 20% that Medicare doesn't cover, there's no maximum cap on that amount. And because that 20% liability is potentially unlimited, then everyone really needs additional coverage on top of Medicare. So let me give our contact information. My name, again, is Dan Small. I'm an independent broker with over 30 years experience helping people with their health plan options. We're located in Milford, right at Thompsonville Road and Route 1. And our phone number is 302-503-7013. My email is dansmall@comcast.net. If you have a Medicare question, don't want to pose it right now, and we return all calls, and we'd be happy to really answer any of your questions on that.
All right, we're going to get a check of traffic and weather and more when we come back with Dan, the Medicare Man, on 92.7 WGMD, the Talk of Delmarva.
Will you still need me? Will you still feed me when I'm 64?
We are back here this morning. We've got a new program. It's Dan, the Medicare Man. He's normally on Saturdays once a month, and now he's going to be on every Saturday during this time slot from 7:30 to 8. And the whole program is devoted to Medicare.
All right. So we left off talking about original Medicare. And remember, our show today is talking about the A, B, C, and D of Medicare. So wrapping up Part A and Part B are original Medicare. Part A is premium free for most. Part B, the standard premium of $148.50. And what you get for all of that is 80% coverage. So everyone will need additional coverage to cover that 20%. And on top of that, everyone will need prescription drug coverage unless they happen to have prescription drug coverage from somewhere else. And that's typically through an employer plan. So what will you need on top of that? Again, a prescription drug coverage, there's two different ways to go about getting prescription drug coverage. To cover you for that 20%, there are two separate and distinct ways to go about covering you for that liability. And that's what we're really going to cover in more detail in next week's program, which is some of your Medicare selections. But Part D is that prescription component. And I know I kind of went a little bit out of order, but it makes more sense to cover the plans that really have an everyday need for almost everyone, and that is your prescription drug coverage. So a little history about the Part D. As I mentioned, original Medicare has been around since 1965. That's the Part A and the Part B. The Part D plans, known as prescription drug, those plans were added in 2006. So it's important to recognize that before 2006, Medicare didn't cover prescription drugs. And so when it was rolled out at the end of George W.'s term, they weren't going to go from not covering prescription drugs at all to covering them 100%. So the government, when they rolled out the Part D plans at that time in 2006, they came out with a standard template benefit design. And all of the companies, because they subcontracted to outside vendors, all of those vendors or subcontractors have to follow that standard benefit design for Part D. So very important. If someone doesn't have a creditable prescription drug coverage, typically from an employer plan, and they do not pick a prescription drug when they're first eligible, they can be hit with lifetime penalties as far as additional premiums on that one. So very, very important to make sure that you have prescription drug coverage, and typically that will be through the Part D. And as I mentioned earlier, there are two ways to go about getting your Part D coverage. And that would be either through a standalone prescription drug plan. For instance, there's 27 of them here in Delaware, or either having that coverage obtained through a Medicare Advantage plan that also includes the prescription drug component. So two different ways to go about getting that Part D coverage. So we covered the Part A. And by the way, the Part D, out of those 27 plans, The premiums now start at a very low $7 and some change in most markets. They can go up to over $100, but we have seen more competitive rates recently on the standalone. Through the Advantage plans, those plans incorporated with the medical and other benefits come in at zero premium. So there's definitely some options out there, and we'll talk about when and how to go about getting those in other segments. So that leaves us with the last alphabet, which is, and this one, Medicare is confusing on so many levels, but this one really kind of, gets people going, especially if they're trying to do this themselves. It's the other component of Medicare is known as Medicare Part C. And we get asked this a lot, if someone needs to have Part C. And the answer on that is no. Right? You need prescription drug coverage, either from an employer or the Part D plan themselves. You need Part A. You need Part B. But Part C is another label for what's called Medicare Advantage. See, Medicare Advantage plans, just like the Part D, they are subcontracted Medicare plans. So they're Medicare plans that are bundled together using a network of providers, using a copay platform, and including some additional coverages. And they put that all together, and that's called Medicare Advantage Part C. But it's optional. So, many people do elect Medicare Advantage plans, but you don't have to have Part C. You do not have to have a Medicare Advantage plan if you chose not to. And again, that's where we're going to spend a lot of our discussions on the core of the confusion that we find with Medicare, and is that there's two separate and distinct ways for you to go about receiving your Medicare benefits. And one is with original Medicare, where you would have the Part A, the Part B. You'd use your Medicare card, show that at any provider in the country. You would have a standalone prescription card in most cases. And then you'd have a third card known as a Medicare supplement or Medigap. And that covers that 20%, with the exception of either a $20 office visit and or $200 and $203 deductible. So that's the one side or one way to get Medicare, which is a 3-card system, but it allows you to utilize any provider and not get hit with surprise copay bills. Now, the downside of that market is that it carries a monthly premium, and those premiums will rise as you mature. However, that market, the Medigap, Medicare supplement market, and this is the most confusing part of Medicare, is that it does not have an annual open enrollment right to change. You receive a once-in-your-lifetime open enrollment to get a Medicare supplement. And again, these Medicare supplements are what are used on top of Medicare. And we're going into more detail on this for our next segment. Now, the other market is known as Medicare Advantage. That's the Part C. And how they work, just generally now, we'll go into more detail later, is that the government pays the Medicare Advantage plans, and it's a sizable number. Last I saw, it was over $10,000 a year nationally on that one. And they pay those Advantage plans to manage all of the components of Medicare. You still have to have your original A, your original B. You have to pay your Part B premium. But instead of using that Medicare card, you would then use that Medicare Advantage plan card. We have 4 companies in Delaware, for instance. I can name those as long as I'm naming all 4. That's Aetna, Humana, AARP, United Healthcare, and Cigna Health Springs. So basically, The government is paying those companies to administer all the components using a network of providers with a copay platform. They throw in additional benefits to really make those plans quite appealing, and they're what I can often refer to, forgive me, as the Joe Namath plans. They're the plans that you hear advertised referring to $0 copayment, $0 premium on that. So very confusing on the enrollment opportunities on when people can enroll in an Advantage plan, when they can enroll in a Medigap plan, and also when they can enroll in a prescription plan. But again, we'll cover that in detail for next week. But one statement that I'm going to be repeating every week on our show, and before I do that, I want to get my contact information out again. You can reach us at 302-503-7013. We're independent brokers specializing in Medicare. So the way that works is that there's no fee for our service. The insurance companies actually pay us depending on the enrollment out there. So we get to represent, those top insurance companies, showing you all of your viable options out there. And I'm really treating it for what it is. It's a commodity. You're going to need it. You just want to make sure you're getting the right plan that meets your needs, not only now, but down the road. And again, our phone number, 302-503-7013. We're located right up on Route 1 in Milford on that. So I think with looking at our time, here's that statement that I want to be repeating week in and week out. So Medicare is confusing on 3 levels: when to get it, how to manage your prescription drug costs if you have, a complex drug list with any brand name drugs. And the most misunderstood is what to pick on top of Medicare. And we'll be covering all of that in the future. But the one statement for those listening is everybody needs to get Medicare the month they turn 65. You want to start the process 2 to 3 months ahead of that time, unless you have coverage from an employer plan and that employer has 20 employees. So that's our blanket statement every week.